William V. Williams, MD, is a rheumatology specialist in Philadelphia, Pennsylvania, with over 40 years of experience in the medical field and has worked for over 30 years in drug discovery and development. He is a graduate of Tufts University School of Medicine and practiced at the University of Pennsylvania. Dr. Williams is currently president and CEO of BriaCell Therapeutics Corporation.
Hi, this is Dr. Bill Williams again, talking to you about some of the side effects of hormonal contraceptives. And today I want to focus on one particular contraceptive, that's Depo-Medroxyprogesterone acetate, or DMPA, also known as Depo-Provera, because it has a unique side effect that is not shared by other hormonally active contraceptives, and that's namely increased susceptibility for women who are on this agent to be infected with the HIV virus that causes AIDS. Now, there's been numerous studies done on this over the years. Mostly these studies have been done in Africa, where there's a very, very high usage rate of DMPA or Depo-Provera, and this is done for numerous reasons, predominantly by the UN, who has some kind of vested interest in decreasing the population in Africa. I'm not really quite sure what their rationale is, but at any rate, they are very, very aggressive about promoting this particular agent, probably because it's very, very simple to use. It's an injection, it's very long acting, it doesn't have to be done very frequently, and so they can assure that women will not get pregnant for long periods of time. Unfortunately, there are multiple studies that show that DMPA increases the risk of infection of HIV in these women who use DMPA. And these risks are quite substantial. There's actually been 4 different meta-analyses done. Meta-analyses are studies where you take multiple different studies and combine them, all the data, into one big study. And they estimate that the increased risk is between 1.4 and 1.5. In other words, a 40% to a 50% increase in the risk of HIV transmission to women who are on DMPA. So this is an agent that many of us think should just be off the market altogether. There are many other alternatives that don't have this risk. Now, there was a recent study that showed that the risk for DMPA HIV transmission was actually similar to the risk of women who use IUDs. And I think this has been used by the people who manufacture DMPA to say, see, this is not really a risk, this is not a big deal. The problem with that analysis, of course, is that the use of an IUD irritates the lining of the uterus and may, in fact, make the uterus more susceptible to transmission of infectious agents like HIV as well, although we don't have a lot of data on that. But at any rate, I think that it's quite clear from these multiple studies that there does appear to be an increased risk of HIV transmission, the virus that causes AIDS, in women who are being treated with DMPA as a birth control method. So I think this is a unique risk for DMPA and really argues strongly that it should not be used. This is Dr. Bill Williams, and thank you for your attention.